I'm Dr. Beverly Reed.
And I'm Dr. Amber Klimczak.
And we are
Two Peaks in a Pod.
Welcome back, everybody. Hey, did you have a good week this week?
Yeah, I've been having a great week. Both my kiddos are sick, but other than that, we've had a lot, like just people going around sick in the office. What's going on?
My son has been sick too. And then I wasn't sure if I had sick versus if I was sick versus allergies. It's that time of year, actually. Same thing for my son. I'm not sure if he's sick or allergies, but yeah, that time of year. Okay, so I have been watching this show called Paris in Love. Have you been watching this? Probably not.
No.
Okay,
no, but I did see some commercial, and I was like, is Paris Hilton still like doing it out there?
Yes. Okay, so you know who Paris Hilton is then. Okay, there we go.
Yeah.
We got something over there. So Paris Hilton had gotten married, and I was watching on Peacock her, little show about how they were planning the wedding and stuff. And she recently had, I think it's a son, and she's been pretty open with the fact that she and her husband did IVF. And so I stumbled upon a quote the other day, and I couldn't wait to see what your take is on this. Okay. Well, okay. Also, I love the Kardashians. Okay. Yeah. So the Kardashians and Paris are friends.
I did know something like this. Like their moms or something? Or like Kris Jenner is...
Kim Kardashian used to be Paris Hilton's closet organizer or something. Like it used to be that Paris Hilton was the celebrity and nobody knew who Kim Kardashian was. So actually, if you see like the old media clips and everything, it's really funny because Paris is like in the center and like Kim's like back in the corner. And it's kind of almost the other way around now. Yeah. It seems like, or they're both very popular celebrities. So. Okay, so she says, talking about IVF, Kim Kardashian was the one who told me about IVF. And she said, I didn't even know.
Kim Kardashian was the person that told her about IVF.
Yes, well, because Kim did IVF, right?
I know, that's just hilarious.
yes. Okay. So she said, I didn't even know anything about it. I'm happy that she told me that advice and introduced me to her doctor. And she says, we have been doing IVF, so I can pick twins if I like. Oh, I've already undergone the egg extraction procedure. It was tough, but I knew it would be worth it. I did it a couple of times. So I wanted to know what you thought about her saying, I can pick twins if I like.
That's a loaded question.
Yes.
First of all, I just think it's hilarious the way they live. Kim told me about IVF, so I did IVF, and it went great.
Yeah.
Like I feel like it's probably a little bit for the media.
Yeah,
IVF is a little bit more involved in that, but it's just funny.
Yeah.
So opting electively to have twins from IVF, right? That's the question.
Yeah, I mean, I think and I think really let's today kind of talk about multiples and fertility as a whole. I mean, I do think that definitely the perception out there is that if you do IVF, you may have multiples. And I think that's really a perception that we probably need to change and update people in the modern fertility world, right?
Absolutely. So I think that is a really outdated perspective. And I counsel a lot of my patients about this because now we've gotten so good at IVF that generally we only put one embryo in at a time when we do an embryo transfer. And so when you hear about people having multiples from assisted reproduction, things, other types of cycles, it's usually from a different type of fertility treatment, not from IVF.
Yeah.
And so, some of you may have been through cycles like this. Just traditional Clomid or letrozole, the chance of having twins when you take those medications is about 7 to 10%. So it's still not very common, but much more common to have twins from those medications than from an IVF transfer. And similarly, probably the biggest chance of twins or multiples is when we have you take injections, those medications that are essentially FSH, and then we do maybe an insemination at the end. That has the highest chance because we're recruiting the most number of follicles or eggs, and we don't have a lot of control over how many your body is going to select and have available to ovulate. With IVF, it's very controlled. Yeah. We know exactly what we're putting in there. One embryo at a time, most of the time. There are certain exceptions to that. We do have some guidelines that can say when maybe it might be necessary. Even when we transfer one embryo, though, there is still a chance that embryo splits, right? So it's about 1% of the time. That's called monogenetic twinning, meaning the embryo splits and you have identical twins.
Yeah. Well, I think sometimes people don't realize too, IVF is a pretty young field overall. And so, back when I was born is really around the time where it was just getting started. But even at that time, it was kind of something that only rare cases had been reported. And then kind of through the years, IVF became more common, but back then the success rates were not good at all. And so back then they did have to put in many embryos, sometimes 6 embryos all at once, and they're just hoping one would stick. But what happened through the years is doctors and researchers and embryologists got so much better at it. The technology got better. And so when they were putting in all those embryos, they did start to see all these higher order multiples. And finally, somebody stepped in and said, wait a second, guys, we need to change how we're doing this. And I think something that has really kind of changed our field too is the ability to do genetic testing. And I think this is kind of amazing. Dr. K actually came from and trained at a place that is famous for doing a landmark study that really changed how we view embryo transfer. Do you want to talk about that?
Yeah, so Dr. Eric Foreman headed up this study, and it was an interesting study. They were looking at, so prior to this, a lot of doctors would still transfer 2 embryos. And what he was looking at is if we genetically test an embryo and we know that it has a normal set of chromosomes, if we transfer just 1 embryo, how does the success rate compare to transferring 2 embryos that are not tested? And what he found is that transferring 2 untested embryos put you at a substantially increased risk of having twins or multiples when you delivered, but didn't substantially increase your chances of just success of having an implanted pregnancy and a baby at the end compared to having just 1 genetically normal embryo transferred. Actually, I'm going to have to look at the brush up on the results, but I think this group was statistically higher, right? And the best group,
I thought they were the same,
just no difference.
Right.
Okay, I can't remember. But definitely there was no benefit to putting 2 untested embryos.
Right. And I think that this was amazing because it really told us if putting 2 in doesn't give us higher chances, why do it? And, yes, twins can be fun, but also twins can be really dangerous. Twins can be higher risk for the mom to carry. Twins can be higher risk for the babies too. They can end up in the NICU. They can have breathing problems and everything. And while technology has also gotten better for taking care of twins, it's also something that we try to prevent because we know that 1 healthy baby at a time is what's best for mom and what's best for baby. And so the, ability to do the genetic testing to allow just 1 embryo at a time, I think really revolutionized our field as a whole. And in fact, our national organization for fertility at that point put out guidelines for us as fertility doctors. And they said, look, the guideline is no matter what age the patient is, if you're putting in a genetically tested good quality embryo, you should only put one in at a time. Okay. And so I think, most of us who are board eligible or board certified doctors want to follow the guidelines that we should follow. And because of that, most of us, will only do 1 embryo at a time. So it makes me wonder if you're Paris Hilton, does your doctor follow the guidelines? Like, does her doctor not have to follow the guidelines? I'm kind of interested in this. What do you think?
Yeah, I think it's really one of those patient education and reframing conversations that has to be taken extremely seriously because I think the desire to have twins when you're going and struggling with infertility is strong.
Yeah.
I mean, I have patients sitting across from me every single day that say, no, I want twins. How can we get twins? So, sometimes that's the first thing they say when they sit down. How can we get twins? And it really, you have to put a lot of effort into explaining exactly what you just said. Much higher risk for you during the pregnancy, higher risk for those babies, and really educating them on what twins really ultimately looks like and the benefits of doing a single embryo transfer. Mm-hmm. And it's tough because, you want the patient to have autonomy and you want them to have whatever outcome that they're seeking. Yeah. But you also took an oath as a physician to do no harm. And what I tell my patients is if I do that, I really could be harming you.
Yeah, right. Absolutely. And so, but as Dr. K mentioned, even when you put one embryo in at a time, it can sometimes divide into two. You can end up with identical twins. I, recently had that happen actually. And I really felt bad because even though I had no control over that, those sweet little twins were in the NICU for a long period of time. I know it was really hard on the parents and everything like that. So we wouldn't do that on purpose, but there's not really anything we can do to prevent that, the splitting of an embryo. And so really the main part that is preventable is just controlling how many embryos we put in. But with that being said, I will say there's always exceptions, right? So let's say a patient chooses not to do genetic testing of the embryos, okay? We know that an abnormal embryo is unlikely to stick, or if it does stick, can end in miscarriage, okay? And we also know that as we get older, the proportion of abnormal embryos that we make increases. So I'm in my mid-40s, and so let's say I did IVF right now, we would expect probably about 90 to 95% of my embryos to be abnormal. And if I chose not to do genetic testing, I did IVF, most doctors actually would allow for multiple embryos to be put in that case, knowing that even with multiple embryos, my chances of it working could be very low, right?
Right. Yeah. And I always talk about that with a patient. It really depends on your prognosis. Yeah. It's an individualized question.
Yes.
And when that would apply. And sometimes it's even after you've tried before and you're trying to decide for the plan for the upcoming transfer. And, what have we seen in the past? What do the embryos look like?
Yeah. But when you're younger, then your proportion of abnormal embryos is much lower. You're much more likely to have normal embryos. And so when you're younger, the guidelines do tell us still one embryo at a time, even if you have not done genetic testing. But a tricky scenario is somebody who is older. So let's say it's me, okay? I'm 45, so let's say I used an egg donor, okay? And let's say I chose not to test the embryos, then how many am I allowed to put in for that, okay? Well, you don't go by the age of the intended parent, which would be me. You go by the age of the person who gave the eggs. And most people who use an egg donor will choose somebody in their 20s, okay? So in that case, you would still only put one embryo in because an egg donor is likely to make a normal embryo, and thus you followed those guidelines for that age.
Really important to understand. Yeah. And honestly, that's a little bit of a challenge too, because usually someone who's going through an egg donor IVF cycle, they themselves have maybe gone through IVF and perhaps had an unsuccessful transfer. And so then they may be more inclined, look, I have multiple embryos now, they may have only had one to work with before. And so then they would be interested in having two at a time.
Yeah. So, I think a good question sometimes a patient has asked me is, because I give them the recommendations, the guidelines, and they say, well, Dr. Reed, do you have to follow the guidelines? What happens if you don't? Do you get put in infertility jail? And I say, well, no, that's not the case, but I also want to follow the guidelines and I want to be a reputable doctor and all of those things. And so I do take it on a case-by-case basis, but in my average patient who's trying a transfer for the first time, I do typically follow the guidelines. And it is sometimes frustrating when you hear about maybe other doctors who aren't, because you have to try to ask, what is the motivation there? I will say sometimes patients will say, you know what? I'm going to find the doctor who will go against the guidelines and things like that. And it's always frustrating to hear when they do find a doctor who's not going to follow the guidelines. And so that's why I thought you might think it's interesting to hear about that.
Paris Hilton's doctor, apparently.
Yeah. But I will say she ended up only having one baby. So maybe she thought she could talk him into twins. And then maybe he said, only put one in, or it could be that they put two in and only one stuck. So, so we don't know about that. But I will say I do make exceptions as well. And so a common reason that I will make an exception is, let's say we've tried maybe 2 or 3 transfers and we keep putting normal embryos in and they are not sticking. Okay. And at that point I say, look, we're kind of outside the guidelines at this point. It may be reasonable, and not always, it may be reasonable to be more aggressive. And I always love this. So Dr. Eric Foreman, who authored the study that Dr. K was just talking about, I follow him on social media. And one time he posted a photo of twins after he had done a double embryo transfer. And I was so stumped because I'm like, he wrote the paper that says we should be doing single embryo transfer. And he explained his logic and thought behind it. And it wasn't a difficult case and everything, but I always laugh because I said, this is like finding out the Pope's sins or something, because I'm like, if Dr. Foreman did a double embryo transfer, my goodness. So, but anyways, I do make exceptions in certain cases. But one thing that I was, thought was really interesting, I went to a conference one time. And I think logically you would think, okay, maybe in somebody who's failed transfers, maybe transferring 2 at a time might increase their chances or might be more efficient or something. But there are certain immune conditions where putting 2 embryos in may actually lower your chances of getting pregnant. And the reason for that is, so our immune system, we make antibodies to fight viruses and bacteria, but sometimes our immune system can get confused and we can make antibodies that fight our normal tissue or fight placental tissue or pregnancy tissue and everything. And if you're putting 1 embryo in, that's just one amount of material for the body to fight off. But if you put 2 embryos in, that doubles the amount of what we call antigenic material that triggers that immune reaction. And so in those immune related cases, they say, you know what? Maybe that may not be the best option.
Makes sense.
And so I do think, I always try to kind of think through the different possibilities, and sometimes I'll troubleshoot a little bit as well. But if we think that it could be immune related condition, it might still be best to just put 1 in at a time, even if it doesn't feel like it's as efficient as it could be.
Right. We should probably mention too, it's not just the hypothesis behind putting in 2 embryos in these scenarios is not just, okay, we're increasing the chances by doubling, putting them in. It's actually that there's a thought that there might be a little bit of like a symbiotic relationship where like they help each other by putting 2 in there. There's a lot of interesting studies about that, and whether or not that really pans out, we still don't really know. But it's not just simply putting 2 in. It's like, will the 2 together work even more so? Yeah.
And I've actually, another good point too, is there has been some conflicting data too, a little bit on what if you put 2 embryos in, one's a good quality, one's a bad quality. Can the bad quality embryo in there make lower chances for the good quality embryo to stick? And so there's some interesting hypotheses, but it hasn't really panned out with good data yet for us to know one way or the other as far as that goes. But I did see another study, and I thought this was interesting because they incorporated it into a calculator that used to be on the SART website. I don't know if it's still on there. SART is the national organization that lets you look at IVF statistics. But they would show you what your chances of success would be if you did 2 embryos at a time versus doing 1 embryo per transfer, 2 months in a row.
Cumulatively.
Yeah. And they did show in that calculator, based on some data, that if you did 1 embryo at a time in 2 separate months, that you may actually have higher chances of it working. So, but again, I think it's a lot of this data is just limited, and we really need more research. This is what you and I got to work on.
Absolutely.
So this is going to be a big part of PEAK. We want to be researching these things to try to get more and better answers.
So important to contribute to the unknown. This is why our field advances as quickly as it does.
Yes.
People dedicate the time to this.
Absolutely. But I wanted to touch on too, so these higher order multiples that we're seeing these days. So I always point out John and Nate plus Kate. You know about them?
John and Kate plus 8. Yes, I do.
Okay. And so everybody always tells me, oh, I don't want to be John and Kate plus 8 and do IVF. And I'm like, no, they didn't do IVF. This alludes to what you were saying before. Usually when we hear higher order multiples, we say, no. We know they didn't do IVF because nobody would be crazy enough to put in that many embryos. And so that's when, and I think I looked back, I think she did gonadotropin. So she did very powerful fertility injections. And then they ended up getting pregnant. And I do always tell people, because sometimes we're in a situation where I gave them, an aggressive fertility regimen, and they come in and they've grown too many follicles. And in those cases, I'm like, look, guys, we need to cancel the cycle. I don't want to put you at risk for having higher order multiples. It's always hard information to hear, because from a patient perspective, they're always like, look, I haven't gotten pregnant ever. I've had a cycle before. It didn't work. It's not going to work now. And I say, look, this is how every reality show starts for multiples. They always start off, I couldn't get pregnant. Right. And then I got pregnant with 8 babies,
Yeah, the Octomom. Right?
Yes, but I'm glad you brought that up, because I did want to bring up Octomom because that's the exception to the rule.
She was an IVF transfer.
She was, yes.
Oh my gosh.
Yes.
I always assumed
Yes.
that she was from an insemination with gonadotropins.
Yes.
Wow.
So her doctor was in California, and apparently she really insisted with her doctor that he put all these embryos in. But here's the thing. I don't agree with that. A patient deserves autonomy, but we deserve autonomy as well.
Yeah.
You can't force us to do something that we know is unsafe. And so that was IVF and an embryo transfer of many embryos, and he did lose his license though.
Oh my gosh.
Mm-hmm. So that's,
See, you do go to fertility jail.
That's right. You go to fertility jail. That's right. Yes. Yeah. So, and that being said too, certainly we end up having patients that have multiples. I mentioned identical twins, but really most of my multiples end up coming from my more like clomid, letrozole, or gonadotropin cycles. Mm-hmm. And I do always counsel the patients, even right before we're about to do our procedure. I can see how many follicles they have. Mm-hmm. And so I'll tell them, look, just so you know, you've grown 2 follicles. According to the data, we know your chances of having multiples is this. Are you sure you feel comfortable proceeding? And I do always like to, just make sure the patient understands what they're getting into as well. And here's the thing. I mean, most of the time, everything works out great with twins, but sometimes they don't even realize the other things that can affect. I saw a study that showed when you have twins, you're higher risk for divorce and things like that too. It's really something to just think through as you go through and just almost prepare for, I think too. If you kind of know what you're at higher risk for, that helps you prepare better as well. So
definitely.
Yeah. Okay. Should we wrap it up for the week?
Great week. Great discussion.
Good. Yes. All right. Well, thank you guys. If you have any questions, let us know.
All right. Have a good week.